You're watching the Baltimore station that works for you. ABC2 News. Good Morning Maryland at 9.
But now we want to move on to today's hot topic. And we're talking about the recent about-face and now warning about LASIK eye surgery from a former official who once led the drive to approve the procedure. Well, what's the danger? That's what a lot of people want to know. And even, is there a danger? ABC2 News' Elizabeth Leamy brings us the interview and a behind-the-look story at this procedure. Take a look.
LASIK surgery promises a chance at 20/20 vision, but a former FDA official says hindsight is what's really 20/20.
Knowing what you know now, would you ever recommend LASIK to somebody you care about?
No, absolutely not.
Dr. Morris Waxler was part of the FDA team that green-lighted LASIK surgery in 1995. But then he says he started hearing about devastating side effects. So today he asked his former employer to issue strong warnings about LASIK.
I think people don't understand this is not like getting your nails done. This is not like getting a curl in your hair.
In LASIK, a thin flap of the outer cornea is lifted out of the way. Then a laser flattens the inner cornea. Critics say that compromised cornea can develop microscopic scar tissue and cause vision problems.
Here's what I look like to somebody with normal vision. Now here's the halo effect that many LASIK patients see. Starbursts like this are another common side effect. Worst of all, some LASIK patients actually experience blurred vision.
According to Waxler's analysis of FDA data, half of LASIK patients experience side effects, and more than a third continue to need glasses or contacts.
My vision fluctuates very frequently, and I have to have new glasses constantly.
The industry counters that most LASIK side effects are minor or temporary, and that complications are much lower with today's modern LASIK. Nevertheless, the FDA is now reviewing the procedure. Elizabeth Leamy, ABC News, Washington.
So obviously we wanted to talk to an expert, someone who performs LASIK. Ophthalmologist Dr. DrBKatzen from Katzen Eye Group is here. Thanks for coming in.
Thanks for having me.
You do the surgery all the time.
Pretty regularly.
I mean, you're going to leave here and go do it.
Yeah.
So when you watch the story, what do you think?
You know, refractive surgery is nothing new. Refractive surgery has been around since the 50s. It's just been getting better and better and better with better instrumentation. And LASIK is really the latest vogue of how to correct people's vision. Overall, it's a great procedure. I operated on my wife in 1998, my mother-in-law in 99, half my friends and family. And I wouldn't be doing it on them if I didn't feel that their outcomes are more than likely going to be wonderful and they're going to be very happy with me because I have to live with them. But at the same time, out of thousands and thousands of people, not everyone's going to turn out perfect. So you really want a doctor who's very selective at picking the best patients and turning away people who might not be the best candidate. So overall, I think it's a great procedure that does very, very well, but there's always a tiny risk with any surgery. The wonderful thing is this is like one of the most satisfactory surgeries with over 98% of people satisfied or extremely satisfied with their outcome. And of the 2% that are a little less than satisfied, 22% of them say they would still have it done again and recommend it to a family. They're just not happy that they're not perfect. No surgery makes you absolutely perfect. The idea is for you to be without glasses. People who run around without glasses, they're not perfect. They see well enough not to have to put something on. That's the goal of LASIK. And many people go in there with the wrong expectations. Hey, I can't see this star at night stargazing as sharp as I could with my best pair of glasses. That's a real possibility. And if your mindset is unhappy with that, then you shouldn't have it done. Or you might not mind just wearing a thin pair of glasses to stargaze.
And you said a lot of it has to do with age as well.
Right. As we get older, we need help reading.
Right. I have
that
reading
sort of
glasses.
thing. So LASIK does not repair that unless you go into something a little bit more complicated called monovision, and that's certainly not for everybody. And so the most important thing is the surgery's been done for a long time. It's been made better and better and more accurate over time, and it's gotten more popular. And I think what happened with this doctor in this interview is he heard from a couple people out of the millions that aren't particularly thrilled to death or may have had a very bad experience, and that can happen, but it's extremely unlikely.
You even said since it is elective surgery, more and more people are going to be vocal about it if it doesn't turn out to be the way.
They're spending money.
Right.
I mean, when you're paying money, you're like, I want perfect. And the idea here is we're getting you glasses free. That's what we're doing.
Have you run into a lot of people who, most of the people I imagine with your wife and your friends and your family, most of them are happy, correct?
I would tell you that 99% of my patients are happy. I do have a couple people who say they're not perfect, but literally nobody who said they wouldn't have had the procedure. And my dad started this, and he was doing the surgery since 1975, and I still take care of those people today, I don't know, 40 years later. So, you know, it's a happy bunch of people, and it's one of the most satisfied patient-based surgeries. So I really do believe in it, and I wouldn't be doing it today if I thought it was a bad thing.
Right, and I imagine patients have this, they address this with you all the time, the concerns about it, so.
Yeah, so I think patients just need to really have the right expectations, pick a doctor who's going to turn them away if they're not a great candidate. And, you know, it's not for everybody. If you're not dying for it, don't get it.
Okay, all right, we'll go do that LASIK. Dr. Katzen, good to see you from the Katzen Eye Group. Thanks for coming
having
in.
me.
All right.